In this demo, you're going to see how the system works through the eyes of a patient, front office worker, and doctor. Our patient, Julie, has just moved to the area and wants to establish primary care with a clinic near her house. She calls the clinic to schedule an appointment, but because she's never been to this clinic before, she needs to register. When the front desk receives Julie's call, they'll log into their system to create new patient. The person registering a new patient would need to ask for all their personal details. Now, the front desk simply asks for the bare minimum information. They ask Julie for her first name, last name, date of birth, and cell phone number. That's all they need to get her scheduled. Julie will have the opportunity to complete her registration on her own time. With this new approach, the time front office staff spend on administrative tasks is reduced. The experience is much friendlier and more like what patients have come to expect from their engagement across other industries, paperless and simple. Patients are empowered to complete demographic and financial information on their own time and without fear of being overheard in a crowded waiting room. The front desk then gets to the page to send Julie a link to complete her registration. Since she's already on the phone, she'll go ahead and schedule her initial appointment with the front desk. In the future, she can schedule appointments by herself online. Let's walk through the self-registration process with Julie, who is sitting at her home using her mobile phone. Julie has received the registration link via text. She can also access this link in her patient portal. Julie provides identifying information to verify who she is. She then clicks Next to begin entering additional information. One of the first things she'll need to do is add her identification. She can do that right from her mobile phone, either taking a photo or using saved photos of her driver's license, passport, or other government-issued ID. Julie will upload the images of the front and back of her cards she conveniently keeps saved in her photo library. Oracle Cloud Infrastructure, or OCI, Document Understanding, will recognize the fields and automatically populate the chart with information from the front of her ID. Barcode scanning fills in information from the back that may be missing or unavailable from the front of the card. Julie then reviews that the information automatically captured was done so correctly and clicks Next. These cards will be saved securely in Julie's file. She won't have to enter this information again at her next visit. She'll simply review and verify the information, or update anything that has changed. Now, Julie needs to add her insurance information. She uploads a photo of the front of her insurance card and a photo of the back of her insurance card. Once again, OCI Document Understanding autofills the fields. Julie confirms the details are accurate and clicks Next. Julie completed this information conveniently at home with saved images on her phone. She could have just as easily taken a photo of the cards using her phone's camera or an in-office tablet. She reviews the HIPAA agreement or any other forms that the clinic needs, signs electronically, and is now fully registered. Time has passed, and Julie is now an established patient with the clinic. She was recently diagnosed with community-acquired pneumonia, given antibiotics, and strict orders to rest. The doctor needs to see Julie to ensure her antibiotic regimen is effective and to follow up on other chronic conditions. Leveraging data from Julie's record, our population health platform prompts Julie's doctor to send her a message in her patient portal to schedule this follow-up appointment. Now that Julie's an existing patient with the clinic, she can schedule this follow-up appointment on her own. Let's walk through the self-scheduling process with Julie. She enters her username and password to pull up a list of appointment options. She clicks the one that fits best with her schedule, reviews the details, and clicks Schedule Appointment. She can add this directly to her calendar. Let's fast forward to Julie's follow-up visit. First, you will see our new patient tracker that the front office staff can use to understand the location and status of each patient they'll see that day. You'll see patients move around the tracker as they go from scheduled to checked in and in room with the doctor through to checked out. These shifts happen automatically as staff indicates in the system that the patient is ready, or as the doctor signs a note when the visit is complete. This allows for a quick, accurate view of how the office is flowing. On the day of her appointment, Julie can check in multiple ways. She can do so from the link on her mobile phone, by scanning a QR code in the office, or interacting with a tablet at the front desk. In the future, you can imagine integrating financial information so that Julie is able to pay her copay through Oracle Health Payments. As soon as Julie is checked in, her information shows up on the patient tracker. We're now ready for in-person visit with the doctor. After checking in and arriving, the nurse takes Julie into the exam room and checks her vitals. The doctor is finishing up a previous appointment before moving to Julie's room, using Oracle's Clinical Digital Assistant for pre-visit activities. Instead of asking Julie about her medical history or why she's here, the doctor will review her chart using AI and voice technologies. The system uses voice biometrics to authenticate the doctor, which is integrated with the EHR single sign-on. This allows the doctor to get up to speed quickly, even while walking from one exam room to the next. Let's listen as Julie's doctor leaves one patient room on the way to her appointment, using various voice commands to find the most relevant information.
Hey, Oracle. Show me my next 3 appointments. Open Julie Smith. Read it out to me.
Julie Smith is a 41-year-old female who was last seen on Friday, September 8 at 4:30 p.m. who has active problems of benign essential hypertension, hypercholesterolemia, and type 2 diabetes mellitus.
Show HCC. Add HCC. Show me my last note. Show me her vitals. Blood pressure. Closed.
What we just heard and saw was the doctor using voice commands to pull up current and past information about the patient, even including the vitals the nurse just collected. We've also embedded AI to generate a succinct patient narrative, pulling details from various parts of the chart. The doctor became familiar with the patient chart more quickly than having to search for past notes, results, or medications. Additionally, the system used data from our population health platform in a couple of ways. It notified the doctor that Julie qualifies for a registry. The system read through Julie's chart and brought together all types of data to determine she may qualify for a certain HCC code. This enables providers to add patients to groups based on diagnoses or conditions to better manage their care and treat them more efficiently and effectively. It also identified Julie as at risk for a food insecurity. This type of information is crucial to ensuring she has the resources she needs, like healthy food, to manage her health. We're now ready for the in-person visit with the doctor. After knocking, the doctor enters the exam room where Julie is waiting. At her initial visit, Julie gave permission to have her visits recorded. Now, at this follow-up appointment, the doctor begins listener mode on our clinical digital assistant.
Hey, Oracle. Start recording. Hi, Julie. Nice to see you. How are you feeling?
We don't hear the full conversation, but we know the doctor follows up on Julie's pneumonia, diabetes, and diet. They also talk about how her kids are doing and what trips she has planned later this year. Throughout the interaction, the doctor is spending quality time with the patient, looking at and speaking directly to Julie, not buried in a computer finding information. Additionally, our clinical digital assistant does more than capture the conversation in the background. It also participates in the interaction. When reviewing her labs, Julie's doctor noticed her blood sugars have been running high and would like to go over this information with her.
Okay, Julie, let's see how your blood sugars have been trending. Hey, Oracle, show me Julie's last 3 hemoglobin A1C values.
The doctor quickly has the information needed to show Julie how her values are trending, without guessing or assuming. The data is at the doctor's fingertips when it's needed. We will now jump back into the conversation to hear the doctor sum up Julie's visit.
All right, I'm glad the pneumonia is resolved. Let's get you set up to meet with our dietitian to enroll in a food prescription program. We're going to increase your metformin. I'll have you follow up in 3 months with a repeat hemoglobin A1C at your next visit. Stop recording.
During that visit, doctor and patient had a full conversation. While they were talking, the clinical digital assistant was running in the background. It pulled out the clinically relevant information and generated a draft note for the doctor with proposed actions to review and sign.
Hey, Oracle. Order metformin 850 milligram, 1 PO BID. Dispense 90, refills 3. Sign it. Review generated note. Sign it. Send Julie an email in a week asking how she's doing and if she's enrolled in the food prescription program.
The doctor has completed the visit with Julie. Oracle Clinical Digital Assistant has lessened the interaction with the EHR, saving time and lowering the cognitive burden. As soon as the doctor signs the note, Julie moves from in-room to checked out on the patient tracker. Julie can go to the checkout desk or simply leave the clinic. She'll receive a link on her mobile phone to complete checkout on her own, where she can download patient education or complete any necessary payments. Not only was each stage of Julie's journey improved, but all the pieces of the system are connected.